All right, so I'm here with Ron Wrigley, who is a lung cancer patient here at the Juravinsky Cancer Center. Hi, Ron. How's it going?
Hi, I'm doing fine, thank you.
So, can you start off by telling us a little bit about your health and just generally anything you'd like us to know?
Sure, I'll do that for you. Okay, let's go back to when I was born. I was born in Manchester, England, 1939, which makes that 3 months before the Second World War started.
Wow.
Not a very good time. Right from a child, I had chronic bronchitis, which is now renamed COPD. Missed a lot of time at school. Gradually, when I got up around the teenage, it started to go away. But I still used to get the odd bout of bronchitis, even in adult life. I came to Canada when I was 18. A lot of people said that my bronchitis was maybe due to the dirty environment in Manchester, England. But when I came to Hamilton, Ontario, Canada, the environment was no better, because I ended up doing most of my work as a sheet metal worker, which is a trade, on Burlington Street. Way before your time, Nick, Burlington Street was just industry from one end to the other.
Right.
Maybe you've heard about it from your father, your grandfather, but that's what it was. And I worked in, I would say, the dirtiest places you can imagine. Foundries, which are the filthiest places you'd want to work in. No mask, no protection whatsoever. Also, for a period of time in the 60s and early 70s, I worked with asbestos. Now that was a Canada Inland Waters, Burlington, which is a government-owned building.
Jeez.
Nobody knew about asbestos in them days. If they did,
Yeah.
they didn't want to tell you about it. So I'm not blaming the industry or the asbestos for my cancer. I don't know what caused it, but there's one big thing. When I was 12 or 13, I started smoking. In them days, everybody smoked. Yeah, one good year, she didn't smoke. But I smoked a pack a day until I was 55. That's 19 years ago. Then I quit. Threw the package away and quit. Now there's another one there. If smoking causes bronchitis, maybe I'm a candidate. Causes lung cancer, maybe I'm a candidate. I don't know. Now, during my 30s, 40s, and early 50s, my bronchitis wasn't too bad. It was bearable. I'd miss the odd few days of work. But we have to remember that today we have antibiotics to clear it. When I was a little tot, nothing.
Mm.
You just have to go to bed and quell it out. I used to miss 2 weeks of school at a time.
Wow. So there's no treatment for bronchitis.
There's no treatment for it. They give you a cough medicine.
Yeah.
Which is the same as today's on the shelf cough medicine. Doesn't really do anything.
Mm.
So I got into the 50s, my age, and my family doctor said, we're getting a little bit too much with your bronchitis. I was getting it maybe 2 or 3 times a year. So he sent me to Dr. Neighbor at St. Joseph's, Charlton Avenue campus, Firestone Clinic. The first thing she did was give me a scan, CT scan, and they saw a tiny little spot on the top of my right lung. So there's nothing they can do about that, not at that stage. So a year later, we go back to see Dr. Neighbor, and she says we're due for another scan. So I go for another one. They found another spot down my right lung again, but lower down. So she suggested this time that I have a biopsy. Now, biopsies are not very pleasant in your lung. It is done by putting a needle through your back into your lung onto the spot and getting a sample. And it can be dangerous. I was told it can be very dangerous. The lung could collapse with the needle going through. But I got through it. I ended up with a tiny hole in my lung. But it healed itself up after a day or two. It was fine. There was no problems. Got the results back, and it was cancer. Dr. Neighbor told me, you have cancer. I thought I took it pretty good. My wife didn't take it near as good as me. But I thought myself I handled it pretty good. I was ready for the worst. It was cancerless. So we sat down, we talked, and she says, it's curable. What you have is curable. So the next stage was going to see the surgeon, who was Dr. Hannah, and this was at St. Joseph's. He sat down and talked to me and looked at the x-rays and everything. He said, oh yeah, I can get rid of that for you. I can zap that out of there, or whatever term these doctors use. I said, good, fine. Luckily, it didn't seem to have spread from the lung. But when he was talking to me, Dr. Hannah says, your voice is awful croaky. So he sent me to another doctor to have a look down my throat. And the doctor said, yeah, I think we have something there in your throat. But the problem was, Dr. Hannah needed my throat to be clear to get a tube down to do the surgery. So he got this throat doctor to go down and take a piece out, like a biopsy, in other words. And he checked it, and that was cancerous. But it wasn't from the lung. It didn't spread from the lung to the throat.